Hi, I want to talk about my SLIMS procedures because I think they're much better than the gastric sleeve and the gastric bypass. Reason I designed the SLIMS procedures are because I wanted procedures that would have lower complication rate and a higher success rate than the gastric sleeve or the gastric bypass. Now, the gastric sleeve works fairly well. It tends to be the most popular procedure out there these days. The gastric sleeve, however, results in regain of weight much more frequently than a gastric bypass. And the gastric sleeve also tends to cause heartburn in a lot of people. And some of the time, this can be very severe heartburn. So, after a gastric sleeve, the number one reason for reoperation is that the patient has regained weight. The number two reason for reoperation is that the patient developed chronic reflux. Now, you can oftentimes treat the chronic reflux with antacids. Now, that'll treat the symptoms, but it doesn't stop the fluid from coming up your throat. It decreases the acid so you don't feel it, but it still comes up your throat. So you still get reflux, you just don't get heartburn. The problem is chronic reflux predisposes you to things like aspiration, pneumonia, chronic coughing, damage to your esophagus from other enzymes that are in that fluid, and on and on. So having chronic reflux after a gastric sleeve is definitely a significant problem. And there's a large number of people, a large percentage that develop that after a gastric sleeve. It's not the majority, but it's definitely a significant number. I would say, in my experience, it's about 20% or one in five. Okay, so the treatment for that is anatomically to convert to a bypass. If somebody says they're going to fix a hiatal hernia, there are three components, and I discussed this in a different video with fixing a hiatal hernia. One, you have to bring the stomach down because the stomach is sticking up through the diaphragm into the chest. You have to bring it down so it's not sticking through the diaphragm anymore. Then you have to close the opening of the diaphragm to prevent the stomach from squeezing back up, but you can't close it so tight that it prevents it completely. The third component is you have to, and it's called a Nissen fundoplication or a fundoplication procedure, and it's standard for treating hiatal hernias and reflux. You bunch the stomach up a little bit, you fold it up around the esophagus. Well, you can't do that after gastric sleeve because there's no stomach there to do it with. So the problem with a gastric sleeve that occurs all too often, in my opinion, is a person gets chronic heartburn. Now, there's a lot of surgeons that'll say, oh, don't worry about it. It's not that common. And they'll just want to do the sleeve. In my opinion, that's because of one of two things. Either they wanted a quick procedure because the bypass doesn't pay that much more from the insurance, or they're just not good at doing bypasses. So they sort of shoehorn everybody into doing gastric sleeves. Either way, it's a bad thing. So you need to know this if you're having a gastric sleeve. To prevent that, I designed the SLIMS lifestyle procedure. So there's a couple of things. Once you have a gastric sleeve, you've removed 80% of the upper stomach, so you can't put it back in. So it's a permanent procedure. You can convert it to a bypass, and there's some other things you can do, but the bottom line is what was taken out is now gone. So what I developed was a reversible gastric sleeve. You end up with a gastric sleeve, but the part of the stomach that we usually take out has been left in. It's just separated from the part of the stomach where the food goes through. It still functions. Okay, it's still in there. It can be reconnected, but it's separated. And as long as it's separated, the anatomy works like a normal gastric sleeve. The second thing that I do with the SLIMS lifestyle procedure is I do a fundoplication. So I fold the stomach that's been separated, I fold that up around the lower esophagus to prevent the eventual development of reflux. And so now you've got a procedure that's not only a reversible sleeve, but it's a reversible sleeve that doesn't cause, in fact, prevents or treats reflux and heartburn. And I do that procedure. If somebody comes in and wants a sleeve and they insist, I want a gastric sleeve, unless they're referred by a friend of mine or something else, I won't do it. And even in that circumstance, I might not do it. I think the SLIMS lifestyle procedure is that much better of a procedure. And so that's the one I'll recommend. And if they don't want to do it, that's fine. It's a sleeve. It's just a reversible sleeve. And it's also an anti-reflux procedure at the same time. So because of those two things, I think it's just hands down a better procedure. The second SLIMS procedure I call the SLIMS metabolic procedure. Now, I just talked about people regaining weight after sleeve, people get heartburn after sleeve, and after both of those circumstances, the most common surgical procedure to resolve weight regain or heartburn is to convert to a bypass. Bypass is a very safe procedure, does not have a high incidence of malnutrition. People need to eat healthy, need to take a vitamin, but that's true with a lap band or a sleeve as well. So converting to a bypass is fine. The other reason people convert to a bypass is the sleeve doesn't work as well for diabetes. So people's diabetes will go away, but then they'll get their diabetes back. And they will come in and say, look, I had the sleeve because I wanted to lose weight and have my diabetes go away. And now I've got diabetes again. And that if you convert to a bypass, typically the diabetes will resolve. So for those three reasons, you convert from a sleeve to a bypass. After you convert from a sleeve to a bypass, you've had both the gastric sleeve and the bypass procedure. Okay. The anatomy you have is a gastric bypass with the portion of the stomach removed by a gastric sleeve that's been gone. So I thought, okay, so that procedure results in better weight loss, okay, more sustainable weight loss because it's a bypass, better resolution of diabetes, more sustainable resolution of diabetes. And it has the benefits of a sleeve, which is decrease the ghrelin, decrease the appetite, and so on. So what I did is I developed the SLIMS metabolic procedure, and I did a clinical trial with it briefly, and it turns out it works very well. And what it is it's doing the gastric bypass for somebody who has, severe obesity and has diabetes, or severe obesity and has heartburn, and they want the best procedure for weight loss, which I think is the bypass. But I do the SLIMS metabolic, which is the combination procedure of the bypass and sleep. So after that procedure, I've had great success. I haven't had anybody fail. Okay. And I've had some patients lose so much weight that I'm actually telling them, look, make sure you're eating because you're down to your high school graduation weight. You're 65 years old. And I don't want you losing any more weight. Yeah, you don't have as much muscle as when you played on the football team in high school, but honestly, you're supposed to have a little more fat at 65 than you did at 15 or 18 or whatever. So just, you know, eat enough. So I find myself in that type of a discussion rather than somebody coming in saying, doc, I'm regaining the weight and I can eat more. I feel hungrier and all of that, or my diabetes has come back. So the procedures I do are the SLIMS lifestyle procedure, which is a reversible sleeve that also treats heartburn, or the SLIMS metabolic procedure, which is a combination of the gastric bypass and the sleeve, so you get the benefits of both. Those are the SLIMS procedures. So I just wanted to mention that. The SLIMS procedures, in my opinion, are better procedures. And if you want to learn more, you're welcome to call me about it and we can talk about it. But I hope you learned something from this. All right.